To go? All right. Well, today's presentation is going to be, as it says, don't let joint pain keep you from your weight loss goals, which fits perfectly with what we were just talking about, right? All right. So the topics, as you have seen on the flyer, I'm going to discuss a little bit about what causes joint pain, how to stay active, when to exercise and when to rest. That's, again, sometimes we mix them around and the result is not what we really want it to be. Good and bad exercises, right? That's my favorite part. And the lifestyle modification to decrease joint pain, just to bring everything together at the end, okay? So now causes of joint pain. The one that I chose that I see the most and I like to talk about is arthritis, right? As a star right next to it, which we're going to see the most. Then we have bursitis, tendonitis, sprain, and strains, right? Now when it comes to arthritis, what can we do about it? Well, we can't really fix that, right? But we can do all these other things in order to don't let arthritis kind of prevent us from doing everything else that we wanted to do, right? So we can work around it without really letting the arthritis be the main problem that we have. Now, anything else that we have in there, bursitis, tendonitis, sprains, and strains, can be things that we work on as physical therapy. I see a lot of them that we try to fix, but they can be very closely related with arthritis. Because of one, we have all these other conditions, and just back to the other way around. Because of arthritis, we can cause all these other sprains and strains into our muscle that limits us and kind of add to make our arthritis even worse at the end. And this is an arthritic joint. I picked the joints that hip and knee, right? That's what we're going to see the most, right? Those are our lower extremity weight-bearing joints, right? And I mean, we're going to have arthritis shoulder, elbow, wrist. It's not really weight-bearing as much. So the ones that I want to focus the most being that we have like kind of time limited before we go on every single joint, hip and knee, right? This is the regular knee joint right here. As you can see, we have all this nice space that we like to have right there. So every time as we walk, we bend the knee, we're not really experiencing any pain. And then this is more like an arthritic knee. Now you get an idea why we're having all this pain, because we don't have that nice space anymore. We develop all these changes, arthritic changes in our joint. We start to wear out the cartilage, which is our meniscus, right? As that wears out, we're going into the bone touching on bone, and that's where most of our pain receptors are. And then we experience all this increased pain just because the changes that are happening. Same thing we see at the hip, right? This is like a nice hip joint, which we have the space, and this is the opposite of that, right? We wear our cartilage. Now the bone, which used to be smooth, now it's becoming rough, right? And that is not just going to roll and glide as well as we want it to be. Now, what is arthritis, right? You can, again, we can look all these things up. This is just something so we'll know exactly what it is in order to go to the next question, right? If we don't know what it is, then how are we going to really answer the question? How can we fix something that we don't know what's causing it, right? So it's a loss of your joint surface, right, that covers the bone, right? It's the joints are not going to glide anymore as smoothly, pain-free, and all that. The loss of the surface is going to eventually cause the pain, increase our stiffness, swell the muscle up, lead to weakness and loss of motion. So all these things put together is going to really limit how much activity we can do, just because of either one or all of them at the same time, right? And with progression, that just starts destroying even other things such as the bone or ligaments and adjacent. We go from arthritis on one joint into developing the other one just because we're wearing and tearing. How does it present? Just a little bit more information, right? Most of the time it's just in a slow gradual, right? Sometimes we don't find out about it until it's a little too late, right? It's nice to always be ahead of the curve, right? But usually if we don't have any pain, we don't worry too much about doing anything, right? Because the pain is kind of what opens up our eyes, right? And then some other ideas that do I have arthritis or not is, are we experiencing any popping, right? Locking or catching? Does your knees or hip, do you ever feel like it buckles on you? Now, what are things that, are not good for us, right? Prolonged positions, right? We don't like any of that. Sitting too long, standing too long, lying down. And most of the time, that's exactly what we're doing, right? It's like, oh, I have pain on my knees, so I need to sit. or I need to lay down, right? I need to decrease all this pain that I have, but that's not what the knee wants too. Actually, we might realize that the opposite can be true on that one, right? And then we have difficulty with all these other activities. We cannot kneel down, squat. Stairs are always tough, but good thing in Florida, most people don't have to worry about stairs. But the ones that do it, stairs can always be tough. I don't know about yourself or not, but
yeah, I wanted a townhouse so I could have a second floor, and now I can hardly get up the 3 little steps that I have.
Correct.
I wish I lived on a flat.
Correct. Yes.
It's getting really hard.
Of course. And then we have hard time finding a comfortable position. Like, how true can it be, right? So that kind of answers all of what's going on here, right? And that the last one was what you just said. You wake up at night or just have a hard time falling asleep, right? So staying active with joint pain, right? Why do we have to do all these things just so we can stay active? We want to improve our cardiovascular health, just the heart and lungs, right? It's if we improve our stamina, we can do more, right? If we're running out of breath, then most likely our form is breaking down as well. So we can go for a walk, which is good for our joint, but if we're running out of breath after the first quarter of a mile, now we're not really walking anymore, we're just dragging along, right? So we took an activity which is good for us and made it bad, just because our cardiovascular health is not there yet to support what we want to do with the rest of it. And then we want to improve our strength, which eventually protects our joint, right? Improve our range of motion, right? We don't want to let any joint, hip, knee get stiff. Right, that's not good for us, right? And then that stiffness is what kind of leads because we're not moving too much, right? It hurts, so we don't move, we get stiff, and then we want to do the opposite, right? We want to start moving it again. We want to improve our flexibility. This is huge. As we start to like experience all these pain, we start kind of doing less and less and less, and we realize that we're like, whoa, I used to be much more flexible. What happened to that, right? Because we're not using it, you know? If we don't use it, we lose it, right? You hear that all the time. It's like, why do I have to be so flexible if I've never have to do that again, right? So we start kind of getting into a very closed, even our walk in its short steps, right? Because you realize if you try to take a long step, it doesn't feel as comfortable anymore. You're not as flexible anymore. And then the last one is like, we got to maintain like an ideal weight, right? Most of all these problems, and we're causing it because of we have to carry all this extra weight with us. Right? When I used to be a trainer, I would always tell people, I was like, let me take you to the gym. I would hand them a 20-pound dumbbell. I was like, just carry it, right? Just carry it for 5 minutes and you come back to me and tell me how you feel. I mean, that will really wear you out to carry a 20-pound dumbbell for 5 minutes. But 20 pounds of extra weight on us, that's what it's doing all day without thinking too much, right? So that's the last one is very, very important. If we want to fix our joint pain because of anything, either arthritis, bursitis, tendonitis, the weight, it's 24/7, right? Other things are most of the day. Weight is 24/7, right? It's always working against us when it comes to our pain. Now, why exercise is vital? It's because we want to strengthen our muscle, because that's what protects our joints, right? The joint itself doesn't have any other protection except for the muscle, kind of giving that stability to the joint or just taking all the tension away, right? So that's why exercise and strengthening is very important, right? At the end, it also improves our bone strength, right? Especially for females. Eventually, we don't want to go into the osteoporosis kind of side because that's bad on its own. Again, with strength training, always careful, right? We want to make sure that we can maintain where we are, right? All these things, if we always say it's too late, then they get worse, right? We cannot fix arthritis, but we can at least keep it where it is, not let it get worse, right? Same as osteoporosis, right? It can get worse, but if we do something about it now, it's never too late, right? It's never too late until it's too late, and then you realize, I was like, oh, it wasn't that bad a year ago, now it's worse. But guess what? Next year, it's even worse, right? And at the end of the day, it just helps you feel better about yourself. Right? That's huge, right? This is all about how we feel about ourselves, and if you're doing this, it's because you want to do it. No one is forcing you. No one is ever going to push you to do anything you don't want. But if it makes you feel better, well, guess what? Chances that you're going to do it tomorrow, it's even higher, right? And so that's, in my opinion, that's the most important, right? If something makes me feel good about myself, chances that me going to do that again, it's pretty high.